Ladies and gentlemen, Edeline Lee.
Hi, everyone. I'm Edeline Lee. It gives myself and Frieze 91 so much pleasure to welcome you this evening. Thank you, NeueHouse, for generously hosting us. 6 years ago, I presented my Autumn-Winter 19 fashion show at London Fashion Week, inspired by classicist Mary Beard's Woman in Power. As I make clothes to dress women in their power, I came to the realization that the fashion stage was an opportunity to listen to rather than only look at women. The original show was presented as a 2-hour marathon of 35 powerful women orators of all disciplines. We have continued with our speaker series ever since, and you can watch them on our YouTube channel. We are thrilled this evening to be presenting the 7th edition and the first New York Woman in Power speaker series. Having just shown our Autumn-Winter 24 collection about mothers and daughters, it seems particularly apt that the topic of tonight's discussion is the maternal health crisis. Amy Fine-Collins and I met some years back. Within minutes of meeting, we found ourselves on our hands and knees examining the underside of a Hoffman chair. We have been fast friends ever since. She is an esteemed journalist, muse, and author. She served as a special correspondent for Vanity Fair for decades and has been editor-at-large of Airmail magazine since 2019. As a partner of the International Best Dressed list, she is a major voice shaping fashion, culture, and taste today. She will be in conversation with Christy Turlington Burns, the founder and president of Every Mother Counts. Formerly a model and incidentally the inspiration of all my teenage fashion dreams, Christy has led Every Mother Counts with over $42 million invested towards awareness, community solutions, and advocacy for safe childbirth worldwide. It is a great pleasure to have you both with us this evening. Thank you.
Welcome, everyone. And yes, with Mother's Day coming, this couldn't be more topical. And I know everyone would expect, with Christy and me together, that the topic would be fashion, or maybe even fashion and art because of Frieze, but we have a more urgent topic. And I'm grateful that Frieze and NeueHouse and Edeline have made this possible. Christy founded Every Mother Counts for personal reasons that turned into a mission, a life passion, a decade-long pursuit of fairness, health, education on the topic of maternal health. And the crisis is something that shocked me, actually. Christy, why don't you give us some basic statistics so we know where we stand in the US and globally on this issue?
Sure. Hi, everybody. Nice to see you all. Thank you. It's lovely to be here. Without getting too grim too quickly, I like to say that I became a global maternal health advocate the day I became a mother, which is now nearly 21 years ago, so it's been quite a journey. I had a really great pregnancy, actually, and a lot of options for where and with whom I would deliver my first child here in New York City 21 years ago, nearly. And I actually had the unexpected happen, which was I experienced a postpartum hemorrhage after delivering her. And in that experience, I think I still understood that I was a lucky person to be in the competent care of a team of healthcare providers that included a doula, a midwife, nurses, and a backing obstetrician. But when I came home after that experience, my heart and my head went straight to the many millions of girls and women around the world who do not have access to the same health care that I received that day. And so I've made it my mission in life to speak out about it as much as I can, to drive awareness for the solutions that do exist. Globally, there are nearly 300,000 women and girls who die each and every year from complications related to pregnancy and childbirth. Those numbers have come down since I started advocating on this issue. The US was ranked 41st at the time, but today we're ranked 62nd in the world for safe motherhood, which is completely unacceptable given how much we spend on healthcare per capita here in this wonderful country. So yeah, we have a maternal health crisis in the United States, but we also have a lot of need outside of the US. And so Every Mother Counts has invested more than $42 million over the last nearly 14, almost 15 years into community-led programs and organizations that are meeting women and families where they are, providing quality care, and trying to ensure safety throughout pregnancy, childbirth, and the postpartum.
One of the shocking revelations reading your material was that mothers' mortality has gotten worse. The odds of surviving pregnancy have gotten worse from this generation to the previous generation. We always think that progress advances, especially in medicine, but it's declining here, and also that the maternal death rate is rising here. Is anyone shocked by that fact?
Yeah, the U.S. is currently one of just a couple of countries that are industrialized, that have a rising maternal mortality rate. And as you say, Amy, it is more dangerous for a mother to give birth today than it was for her mother a generation ago, particularly for our Black and brown moms who are disproportionately impacted by the lack of access or quality care or consistent care in pregnancy and childbirth. 2 to 3 times more likely to die from a pregnancy complication, and Native women are just behind Black women. So, and in a city like New York, surprisingly or maybe not surprisingly, that can be up to 12 times more likely to die in a pregnancy complication, depending on which borough you happen to live in.
New York, the most sophisticated city in the country, if not the planet. It's a tough job for one woman to take on, but you have partners in this cause globally, right?
Yes, yes, I by no means am doing this by myself. I have been doing all I can to raise awareness and to become the best advocate I possibly can on this issue at a global level. But there are other organizations that we partner with, and we have grantee partners in communities across the United States, as well as in 9 or so other countries around the world that are all working tirelessly to provide quality care, competent care, or culturally competent care, I will say, to the folks that might otherwise be underserved. You know, it's not enough. More people need to be aware of these challenges and also to be advocating on behalf of those who maybe don't have their voice or power to do so. We do a lot of advocacy around just having more support, just so that people can feel supported throughout the process and have their voice and their words be listened to and respected when in maternal health care.
One subject that we were discussing was the fact that obstetrics is declining as a choice of specialization among medical students, and that hospitals are closing. These are 2 factors in the declining ability of the healthcare system to serve mothers. And Christy has also been making sure that there is more education for doulas, for midwives, who can fill in this healthcare gap. But to turn this to fashion for a quick second, I was telling Christy also that Azadine Alaya, who's a designer that we both worked with in different capacities. I hope you know his name. He died a few years ago, but he was one of the great masters of fashion history. He had told me that when he was a little boy, he used to help his mother's best friend deliver babies. And I was so taken when he told me that, the idea of a male child, actually a male gay child, assisting at the delivery of infants, and which helped explain to me, as a fashion critic and a fashion historian, how he was so enamored of the woman's body. He was fearless. Like, he went places where other designers didn't go, including the G-strings for the dancers at the Crazy Horse. But this discussion led to Christy making the point that this was something normal. I thought it was unusual, but it was normal in a place like Tunisia, where he grew up. So can you explain about the difference between childbirth, in the attitude toward childbirth here versus in other countries, the cultural differences?
Well, just to give a shout out to Mr. Elia, he really was a legend and someone that I feel very lucky to have spent time with over my many years working in fashion. But he loved women, and I think a part of why he loved women was because he was close to women. He was raised by women. I think physiological birth is something that weirdly has been medicalized, like most things in the West. But Azadine grew up in a country and in a time where it's very normal to have your sibling be born in your home and to assist in some way, but to be present during a birth. It was, if not just a family experience, it was certainly a neighborhood or a community experience. And everybody knew when a baby was born, and everybody knew what the outcome of the mother was, and everyone was invested. That is not the case in our society today. And I think the medicalization piece of it has been actually adding to some of the complications. Unnecessary surgery for pregnancy that is otherwise a low-risk pregnancy actually adds risk to the mother's life and adds potential subsequent risks postpartum for subsequent pregnancies, et cetera. So we are so far from, I think, what most of us probably have come from in terms of our family histories and our ethnic backgrounds or cultural backgrounds. And it's a shame, really. A lot of what's come out of the awareness around what's happening in the United States is this sort of lack of accountability and this lack of community participation and investment in the health of women and families in this day and age. And so we do a lot of work trying to build the pipeline of what they call mid-level providers, midwives who can do everything except surgery, but they really do provide like whole person care throughout pregnancy, postpartum, and then I would see my midwives even for well woman care after I was having children myself. And then doulas, obviously, that I think more and more people know what doulas are, and they are basically patient navigators that have witnessed a lot of births, who are there to really support mom or birthing people to be able to advocate on their behalf, to be able to understand what their needs may be in any given time. And those two cadres of the workforce are critical, and I think really are what inspire me most about how we're going to fix this problem. But of course, there's a large ecosystem in the maternal or women's health space, and it really requires all of us to play our part in order to ensure the best possible outcomes.
Well, because we've given so much gloomy news, I will give some better news, which is that through the work that Christy and her colleagues have done, Medicaid has been extended in most of the states in the U.S. for women postpartum, because the deaths that we're talking about, the mortality, really happen anywhere from like the moment of birth all the way out to 1 year after birth. Sometimes it's a mental health consideration here. Most of those long postpartum deaths are from overdose or suicide. And Medicaid had just stepped out after 60 days, was it?
6 weeks.
6 weeks, okay, that's even worse. Well, actually, no, I did my math wrong. But I knew it was 6 something. So there are only a few states left who have resisted extending Medicaid to mothers. 4 or 5 states who are refusing to, one of them being Arkansas and another being Iowa. But so legislation has changed state by state. When you started, it was a much lower percentage of the states who had that extended Medicaid. I would say that you have accomplished a lot, and you've got a lot more to do, a lot further to go. And I think we must have in the audience how many people in the audience are mothers, first of all? Okay. Well, I'll include myself. My daughter is sitting out there somewhere. Who I haven't even said to you exactly what problems there were with the hospital and the doctors when I was giving birth. But one thing I have learned is that every woman has a story. I don't think I've heard of anyone speak about their experience giving birth, their doctors, whoever was taking care of them, getting exactly the care that they wanted and the respect that they wanted and being listened to the way they wanted. For example, Flora, when I called the doctor when I was having my labor contractions and told him it's time for me to go to the hospital, he said, "You're not in labor." He was on the telephone. I said, "I am." He said, "You're not because you're too calm." So, I mean, that's just sort of my temperament. But I prevailed, and there's more to the story than that. But, okay, even those who are not mothers, you all have mothers. This is a universal fact, right? So this cause, this concern really applies to everybody. And I'm really sad that things have not improved. I was also telling Christy earlier how Flora's grandmother, my mother, was put at terrible risk because she was given a medication called DES that was given for 2 decades plus, like the 50s through the 70s, to mothers who were at risk for miscarriage. And it turned out that it caused cancer and infertility in almost a majority of the daughters, not the sons of daughters born. Somehow I missed that bullet. But these kinds of practices are still happening where women in maternity wards are given medications and submitted to procedures like cesareans that they didn't sign up for and they don't even know are about to happen. And we also discussed briefly the Dobbs decision and how the withdrawal of abortion rights is going to exacerbate this problem. Do you want to explain what the connection is?
Yeah, I mean, so many things in what you just shared. So obviously, the conversation right now around abortion and access to information and services impacts all of us. It certainly impacts the outcomes because services are less available and because maternal health and abortion care are health care. When you have more limited access, it creates a lot of problems, and it creates very scary scenarios, particularly for again, the most underserved populations who don't have the means to travel out of state or across the country, depending on where one lives, to be able to have access to life-saving care. When I started advocating on this issue, we used to say a stat, which was that 15% of all maternal deaths were caused from unsafe abortion. That number is going to change drastically if we continue to see the rollbacks that we are. It's estimated that there'll be a 33% increase in death in Black women and a 21% increase in death for white women, just because of the limitation on services that can provide care for women and families. So that's terrifying. I mean, I know there's so many scary things happening right now, but as a woman, as a mother of a daughter and a son, it not only makes me scared and sad, it makes me angry. And I think that in this election year, and given that we have the means to be in this room, in this space together, that means that we do have a voice and we do have choices. And so I just implore you actually to use your voice and to share any of the information that we've shared here, and certainly any information that we have on our website, everymothercounts.org, where we do talk a lot about the legislation that is already out there that needs more support. That is, looking beyond just our individual selves, but again, paying it forward to the communities and societies that we want to live in. The time is now.
So I keep thinking about all these deaths happening every 2 minutes. Is that what it is? Every 2 minutes a woman dies in childbirth. And here in the U.S., it's not quite that drastic, but it's, again, surprising. What actually is happening? How are these women dying? What is the cause of death? Like, is it the hemorrhaging, like you had, the hemorrhaging where you could bleed out? What are the other circumstances, the health conditions or pre-existing conditions that create this problem?
In the U.S., the leading cause of maternal mortality is actually hypertensive disorders, so cardiovascular-related complications, and that can come from chronic health issues like diabetes, obesity, stress. And then postpartum hemorrhage is a close second. Sepsis remains another cause of death, but largely preventable. I think 80% of all maternal deaths are preventable. And so that's the other, in addition to my experience, in addition to the need for someone to be talking about this issue when I started, what I think excites me about the opportunity is that, the bar is low. Just by talking about it, just by sharing information is a huge, huge thing that can be done. And 80%, it's not great, but it's certainly not as bad as it could be. And so, we want to make sure that every preventable death is prevented. And the only way we can do that is to decide that women's lives are of equal value and that they're worth saving.
When I first learned of your charity, I did what I always do when I get involved in any kind of charities, look it up on Charity Navigator. And something like Donald Trump's foundation would have 0 stars. Christie's foundation has 5 stars, which means that most of the money that they collect is used for the purpose that the foundation was founded for, and very little for administration or salaries. So that was impressive. It's hard to get those 5 stars. You can't fake that. That's like having the IRS look at your at your accountability.
Yeah, I mean, it's not to underestimate that certain expenses. I mean, it costs money to raise money, and it costs money to make sure that funds are allocated responsibly. But it is important for us that the dollars raised are going to the communities that need them the most. And so personally, I take that very seriously, and my role as a founder and president is stewardship. And I really, as a donor myself, as a philanthropist myself, I understand, how much we all want to make a difference and how much we all want to participate in creating a better world for all of us. And so I know that those things matter. And I'm like you, I look them out of every organization too.
You hunt them down. Well, could you comment maybe on how your background, I mean, it's a kind of a 180 detour from what your original professional background is, but I can imagine you must have drawn on your ability to appear in a public situation in front of a camera. How has that background helped you do what you do now?
I mean, I guess just my collective years have helped me as I've gotten older, but it's not, I started working as a model when I was a teenager, and so I guess there's some parallel in that, teenagers are also very vulnerable to pregnancy-related complications around the world. Otherwise, there's not a whole lot of correlation. I mean, I do think that relationships that I built over time with a lot of the biggest brands in the world and some of the best designers in the world and a lot of those companies now really wanting to also, well, they always did actually. There were always great fashion brands, from our earlier history together with AmFar and, really the fashion world coming together to rally against AIDS, breast cancer. Like there have been some incredible collective efforts, and I think I've learned a bit from that and observing that and participating in whatever way I was being asked to. So yeah, I guess in that sense. But yeah, I look at my experience really becoming a mom as directing this part of my life, and up until that time, I went back to school in my mid-20s to get an undergrad after modeling for 10 years, and then I went back to study public health.
I heard you were a good student. Actually, one of my professors...
I was a very good student.
Yes, a professor I had at Columbia in art history had you as a student at NYU, and I remember him, and I've remained close friends with him, and I remember saying, "Oh, Christy Turlington's in my class. She's a really good student."
Yeah, I think adult students tend to sit in the front row, and I was eager to be there by the time I got there, and so yeah, I didn't miss a class. But yeah, I'm a student. I'm a forever student, actually, and I think that's what I love about the work that I do now is that I'm learning constantly, and as the world is changing, we're having to adapt to, again, not leave folks behind, and so it's what excites me and what motivates me and makes conversations like this exciting for me because while I don't like to bring gloom and doom into any room, I do like to meet new people who haven't thought about this before, who might be thinking about it in the future, who have something that they can contribute, whether it's your own story or resources or whatever it might be. So I really appreciate the opportunity. And Edeline, I'm really grateful for your platform to be able to share with this crowd tonight.
And since we have a large representative of the art world here, I mean, I assume a lot of people here are from the art world because of Frieze. I was trying to imagine how the art world can engage more in this issue. And I did see that Christy had a auction at Sotheby's at one point to raise money for her organization. But it was mostly jewelry, right, at that time?
Yeah, it was different. Jewelry and photography and some art pieces, actually.
Some art pieces. Yeah, and that would be great to get artists to contribute to this.
I mean, our logo is a Madonna.
I was just going to say
that. I mean, think about one of the
most
sort of art world inspired topics and relationships. So there's a lot of, I think, it's something that does evoke, both literary and painterly types of connections and inspirations and emotion. I mean, we like to partner with folks who aren't necessarily in public health and global health because you want to find new ways to bring people into something that is a shared humanity. So art certainly is that for most of us.
And that certainly is the primary image of art, the mother and child. There's an exhibition at MoMA right now of Kathy Kollwitz, who was a German artist working in the early 20th century up to World War II. And her images are over and over again, mother and children, but they're always in peril. She's often holding, the female in the picture, the mom's often holding a dead infant. It's very gut-wrenching artwork, but I recommend that you look at it. She was an incredible draftswoman, and it really goes right to the core of the maternal need to protect her children. There are sculptures like that too, where it's almost like an animal instinct to take care of your children and of yourself. So that all occurred to me just looking at your logo. Who drew that logo?
It's actually a funny story. When I before I started the organization, I made a documentary film called No Woman, No Cry. And before that film came out, I did an article for Vogue, where Vogue profiled me making this documentary, and they assigned a Magnum photographer to come with me to Guatemala. And as the film was going to print, I didn't have a name for the film, but I had this idea for No Woman, No Cry, which is obviously a Bob Marley song. It's very famous. And I knew some of the people from the Bob Marley family and the foundation. So I wasn't required to ask permission before naming the film No Woman, No Cry, but I really wanted to feel good about it, and I wanted their blessing. So just before it, and this is when magazines took still like many months to be published, but right before the close of the issue, I got permission and to use the film's name. And then I got a call when the magazine came out from Howard Schultz at Starbucks, who said, "Hey, we make these music compilations, and maybe for your film you'd like to use some of our music." And we already had a score and we already had music, so I couldn't really take him up on that offer. But they did create these compilation CDs the year after, which then benefited maternal health programs around the world. And there was an artist that worked for Starbucks who created that first.
The mermaid?
Yeah, she had created that, but then she created for us, a mother and child. And it resonated so well with the name of the organization, and so eventually she recreated it in the sort of scale of what we now use. And she said, "Please, I'm a single mom, and just working on this subject and working on this project has made me really feel connected to the cause, and so please use this artwork." And so it's stuck, and I love it so much. It really does, without the words, it really does symbolize what we're hoping to achieve with the work that we do.
So, Christy, I think we have run out of time and that we can take questions now.
Okay.
And if you have any parting words, now's the time. Or we
I'd
can
love to hear questions. Yeah.
And really, we would also love to hear some women's stories too. That's part of what this whole process is
Looks
about.
like
There's a question back there. We can send a mic back.
I alluded to this one, to legislation that right now, there are more bills right now on the topic of maternal health than ever before. There's a collection of about 13 bills that are called the Momnibus that have had momentum and address all of the many factors. I mean, for me personally, this Medicaid extension piece is a significant one. More than 50% of the births in this country are covered by Medicaid. So when you have things like hospital closures, with hospitals that are the one hospital in town or the one hospital in that part of the state that are providing care for Medicaid patients, that's devastating. Another thing, in this very large country of ours, it's a very rural country. So when a hospital does close in one part of a state, like New York, upstate somewhere, suddenly a mother will find herself where she's delivered 2 or 3 children at the same place with the same provider, but now the closest hospital is 5 hours away. If a woman has a hemorrhage like I had, you can die in under 2 hours. So transportation is a challenge. So one of the other things that we've advocated for are more birth centers, more, again, to follow along with midwives and doulas who are working in communities closer to the communities that they serve to make it easier for people to have care throughout their pregnancies and only be referred upon emergency, and then to have plans in place to be able to move them quickly. Health disparities, looking at medical racism, explicit and implicit bias that exists in our medical institutions is another big factor. So lots of curriculums and trainings to make sure that providers are trained to treat every patient, no matter what color they are, with respect. That's an easy one. I think we can expect that that should be able to be possible. But you alluded to this being a dwindling specialty in terms of obstetrics and medicine. We have doctors who are practicing medical care in a very broken system, and so people are afraid. And when people are practicing afraid, they tend to make bad judgments. And so those bad judgments and the way that they're practicing is actually really harming women and their families. There are a few countries, actually. They're largely in Europe, and they're largely countries that have universal health care. And midwives are sort of integrated into that healthcare system. So, places like the Netherlands, Scandinavia, not surprising. The UK, while it's not perfect by any means, it does have a health system that has been an example for a lot of other health systems. Canada, Australia, places also where, like the UK and Australia and New Zealand, these are places that you can have a visiting home nurse that is offered to you through the health system for about 2 years postpartum. So imagine if you were really isolated and you were a new mom and you didn't have help or care or a family nearby, having that call from the NHS or NHS, just to say, how are you doing? How are you feeling? Anything you want to talk about? What a lifesaver that could be.
Down here in the front row.
Yeah, I mean, there's that whole conversation around student loans and all of the things that also is a deterrent for folks going into medical school as well. Yeah, we have an issue here too that needs advocacy, which is around reimbursement. So we only have, I think, about 14,000 midwives practicing in the United States. Obviously, globally, that's a much bigger number, especially where midwifery is not something considered alternative. But midwives and doulas, which there's evidence to say that they improve the experience of care for most moms and families, there's no coverage for them. There are very few states where midwives, for the same amount of time, the same quality of care, don't get reimbursement. So that's a big issue. And yet, obviously, medical school is not accessible to everyone who has the desire to want to support women and their health care.
Okay. And, I don't know if it works if you say, listen to me, I know my body. I don't know, what do you say?
Yeah, I think that is really the key role of a doula to play. And often doulas, while there are community doulas, there are also other kinds of doulas. In this city in particular, there are a lot of them, and a lot of them work on a sliding scale so that they are accessible to all. But if you can afford one and you can get one early on in your pregnancy, they really do help navigate just the whole terrain. Because there's a lot of information out there. What's almost more scary than too little information is too much information. And I think it is scary to go Googling around for this feeling or that feeling. And again, going into a pregnancy where you have fear throughout, it doesn't set you up for success at the end of the day. But where a doula can really be by your side, build relationship with you so that no matter what happens on that day, they're there to say, no, you're just going to tell that nurse, no, thank you, I'm going to just stay right here. And patients have rights, and those rights should be very front and center in most of our hospitals. If they're not, you can always ask, what can I see my patient's rights in this facility? That takes some confidence to do. I'm sure many of you heard about Serena Williams and her postpartum complication. Serena Williams, who's arguably the strongest, most incredible female athlete of our time, she had an issue postpartum, and she knew something was wrong, and she kept demanding and demanding and demanding, and they listened to her. Serena Williams. It's not every woman who feels as empowered as she does to do that. And then she had her partner also, right behind her saying, get my wife this. That doesn't always work out that way. So having as many people that are, aware of what your needs and wants and desires are, having a team to help support you, that you get what you want. And that takes practice and it takes time unless you can hire someone to help do that for you.
Okay, so in the second row.
Yeah, absolutely. Thank you. That's a great question. Yeah, I mean, like I said, I think it's educating yourselves around the issue if this is something that has touched you in some way, personally or just by hearing and anecdotally. There's always someone in the room or someone that we know in our lives who's had some experience that's been either traumatic or it's had a really bad outcome. And I think just sharing those stories and talking about those stories. When I had my experience, I remember first talking to my sisters, then talking about to my sort of closest circle of friends. And when I shared what happened to me is when I started hearing other people's experiences. For whatever reasons, we're not helping each other out by not sharing our stories. And so I think as important as it is to share when things don't go right, obviously it's important to share what could and should go well, right? What to expect. We don't know what quality of care looks like. We think that means like access to a hospital and a doctor. That's not necessarily true. It means being seen, being heard, having the comfort to be able to ask any question, again, within the time constraints that our physicians or nurses have. And then there's a lot of good information out there. I'm not sure if any of you have heard of Emily Oster, but she is an economist who's written a lot around, sort of breaking down some of these statistics that can be terrifying, right? Like, my risk is this. What does that mean? Because when you're carrying a life, you're like, what if I eat this, and what if I do that, and what did I do? I mean, it's a lot of responsibility, and it can be very scary. And so there are some people out there who have been breaking it down to simplify it, but not to the point of like oversimplification. I think in the point of just making the information easier to talk about, more open to have a dialogue. And then the piece around self-advocacy, like, it requires practice. Most people don't feel comfortable in a hospital saying, like, what about this test and what about that? Like, we just come into that situation and we give up that sense of who we are. And it's like, this person knows more than I do. And we need to have more comfort and confidence. And I'm sure the physicians are like, oh, we don't like those patients. Because those patients can be difficult sometimes. But
it goes right on your chart. Difficult patient.
Right.
I saw that on my file once.
Really?
Yes.
Very calm, difficult patient. No, just kidding.
Apparently.
But I think it's a relationship, right? It requires a patient and a provider coming together and having like mutual respect and the sense that we're going to do this together. Not saying it's all the fault of the patient or it's all the responsibility of the provider. And I think the more that we can get that relationship at a more balanced, equitable place, I think we'll see better outcomes.
I think we are at the end of our time limit. I'm sorry. If there's one quick question that we can give a quick answer to.
Great. And parental leave, I would say, is very top of mind. I think corporations are starting to do, as you say, they're listening, because I think those conversations, and luckily just the general awareness, I mean, I think most people know that this country is behind pretty much every other country with regards to parental leave, but each state has made some advances, and New York State has. And so that's a great thing to ask for. I mean, I think nationally, 2 weeks coverage is sort of the average in the United States, which is nothing, especially if you've had surgery, like major abdominal surgery, and you're expected to go back to work and you don't have insurance. I mean, that's terrifying alone. So that's a really good point. I think if it's offered, asking, is it going to get better? When will it get better? it's like the constant of asking for and then demanding.
Okay, so that's it. That's all, folks.
Oh wait, wasn't there going to be somebody who had to say something at the end?
Oh, we have one concluding remark from.
Yes,
Come,
they
come,
are.
come.
Oh,
Can I
God.
help?
And the lights are
I
bright.
know,
Oh, my
see?
goodness. Well, good evening, everyone. I wanted to say first, on behalf of Frieze, a huge thank you to Amy Fine-Collins, Christy Turlington Burns, and Edeline Lee, the beautifully dressed Edeline Lee. And obviously to everyone. Yes, a round of applause. For those of you who aren't familiar with Frieze 91, we are a global membership program which aims to bring members closer to artists and the art world. But as you would have gleaned from this evening, we also explore wider, timely cultural conversations within our program, and it was an absolute honor to be able to support this talk tonight. If you enjoyed this evening and want to join us for more conversations like this, and of course, enjoy all of our fairs, I would encourage you all to join Frieze 91. There really is no better time, and I'm thrilled to be able to say that we'll be donating 25% of all new members' fees to Every Mother Counts. As Christy mentioned, you can find much more information online and via some of the colorful flyers that you would have seen on the tables and the chairs today. And myself and the team will be around, not all evening, but for part of it. So if you have any questions about how to join and how to support, please come and find us. Thank you again for joining us, to NeueHouse for hosting us, and to powerful and amazing women. Thank you, Amy, Christy, and Edeline. Please join me in thanking them once again.